Hello everyone. As I promised that I'll be back with you with our topic radiation therapy. As we seen in the previous video that we talked about internal beam radiation therapy that is known as brachytherapy. And those who haven't watched it, please go and watch it out because it's very, very important. It's the high yield topic of the NCLEX. And trust me, you're going to have one questions out of your exam. And most probably the SATA questions because there are lots of people, there are lots of students that says that they have had these questions before in their exam. So you don't want to miss it. So please go and check it out. And in this today's video, we're going to talk about external beam radiation that is known as teletherapy. That is external means outside of the body. It is not radioactive means the patient will come. The doctor, the radiologist will give the external beam radiation on the particular area of the body and then the patient can go. It will be on the OPD based client. Patient will come due to the radiation and after some time they can go to the out of the hospital, they can go home. So in this topic, the priority will be radiation dermatitis, as you can see. So radiation dermatitis means whatever the local area you're giving the radiation to, there will be dermatitis. So as a nurse, your priority is to prevent it. You don't want to let it happen, but it's very common. Because radiation jata hai, the skin burns, and then it's known as radiation dermatitis, and it's very common. So there will be a care of that area, and this covers the skin integrity part of the exam. So there will be a SATA question that how you will take care of that patient and how you'll maintain the skin integrity. So first you wanna gently wash the area, just hand wash. You don't wanna use any kind of product. Like use lukewarm water. It will be mild. It's fragrance-free soap as prescribed. Never rub, never scrub the skin because there is a chance कि वो peel off हो जाता है, right? So dry completely with soft towel. You don't want to scrub it. Preserve any ink markings by radiologists. Do not wash it. So the ink markings के जो भी area है where the patient wanna have the radiation, उधर you don't want to rub it. Otherwise, it's for the reference for the radiologist कि इधर का हो चुका है, इधर का होना बाकी है, like that. You don't want to wash it off. Otherwise, उनका miss हो जाएगा. जो भी follow up होगा वो miss हो जाएगा, right? So you don't want to wash it. Avoid applying unprescribed lotion, deodorant, powder, cream. So do not use these products. Prohibit heating pads, ice packs, adhesive tape, direct sunlight to treated areas. उधर कुछ भी नहीं लगाना. Like you just let it be like that. You don't want to use any heating pads, ice packs, adhesives, nothing. So you gently wash it, liquid water. Do not rub, do not scrub. Preserve any markings if there. Avoid applying unprescribed lotion. You don't want to use anything. Just hand wash, lukewarm water. That's it. Systemic side effects and nursing assessment, that what will be the side effects of the radiation therapy. So the radiation fatigue की जिधर का भी हम radiation दे रहे हैं उधर the patient will have radiation fatigue की patient बहुत restless हो जाएगा, वो थोड़ी activity में थक जाएगा. So it's very common whoever the patient having the radiation therapy. So the management is to frequently rest and prioritize the activities. Chances of having bone marrow suppression if large bone like pelvic or spine is involved, then monitor for CBC level. Watch for leukopenia, which is low WBC. So अगर WBC कम हो जाएंगे तो there will be chances of having infection. और this is a very common. और इधर से ही death होता है, the patient का death इधर से ही होता है कि infection हो जाता है. There is very less WBC to fight against the infection, and then before you know the patient they are passed. Thrombocytopenia, bleeding risk. Thrombocytopenia, low level of platelet. कि bleeding बहुत, there are not enough platelets in the body to clot the blood. तो इसके वजह से bleeding, अगर थोड़ा सा भी gum bleeding हुआ, थोड़ा सा भी rectal bleeding हुआ because of constipation, तो there will be chances of bleeding, the very heavy bleeding, and then you won't be able to stop it because there is not enough platelets. Anemia, it's very common in the patient who is having chemotherapy, who is having radiation therapy, overall the patient with cancer. So anemia, low level of the RBC, so sabhi ke level, the sabhi cells are decreased. GI mucositis, forehead and neck radiation, check mouth ulcer. Because GI mucositis means the mucosal layer का inflammation, infection हो जाता है. Especially in the GI organs, किधर भी हो सकता है, mouth में भी, stomach, small intestine, large intestine, rectum, anywhere. What is happening that the mucous layer है उनका, it's infected. It's commonly seen in the mouth ulcers. So it's better that you frequently check patient's mouth, and then you promote oral hygiene with non-alcoholic mouthwashes and soft toothbrushes. Otherwise, if there will be hard, then there will be chances to have the gum bleeding, and you all know that there will be cytopenia, anemia, and the leukopenia in the body. If there is lots of lot severe thrombocytopenia, then the bleeding you can stop it, right? So you want to watch for it. As we promised that we'll be having the question answer in this video. So the question of the day is: the oncology nurse completes a morning change of shift report. Which client should the nurse assess first? So this is a priority question. So let's see the options. I hope you all got the question that the oncology nurse है morning change shift कर रही है. जैसे ही nurse enters in the ward, which is the person she should go and check on first. So the first client is the external beam radiation to the neck, who reports a painful dry mouth and difficulty swallowing the soft food. कि external beam radiation therapy है, उसका complaints है he's having pain, dry mouth, and difficulty swallowing the soft food. Second is a client with cervical brachytherapy who reports sudden sharp pain and a sensation that something slipped. The third client is a client with colon cancer receiving chemotherapy colon cancer, chemotherapy, whose absolute neutrophil count is 1200 microcube. A client with lung cancer receiving radiation who reports severe fatigue and has HB 9.8. So who do you think you can go and check on the first? So I think the second is our answer. Keep cervical brachytherapy, that is implantation in the cervix, or sudden sharp pain and sensation that something, it means the implantation has dislodged. So this client takes the priority. You go in the patient's client, you put on the lead apron, and then you take the lead long handled forceps, you pick it up and then you put it down in the lead container, and then you close it, and then you inform the radiologist that this has happened. And it's very common, as we talked about in the last video. So let's see why these three are not the right answers. So let's see. First, a client with external beam radiation to the neck who reports painful dry mouth, that is known as xerothalmia, difficulty swallowing the soft food. So these are the very common side effect of external beam radiation therapy. So it doesn't take any priority. Third is a client with colon cancer receiving chemotherapy whose absolute neutrophil count ANC is 1200, which is less than 1500, that is normal. So this is also requires your attention, but it's not the priority, immediate priority. A client with lung cancer receiving radiation who reports severe fatigue and has HB, so which means anemia, patients having anemia. So the patient with cancer is normal to have the anemia. It also requires your attention, but it's not the priority. So our priority client is brachytherapy, whose implant has dislodged. Thank you very much for watching. I hope you all like this video, and I'll be back with another video with you. Thank you very much.